Welcome, everybody, fellow Activate participants here. My name is Stephen Gerhardt, and I'm joined by Sean Grigg today. We're both from Element Blue. I'm the managing partner and CEO. Sean also partner and VP of our delivery and digital services at Element Blue. So thanks for joining us for this quick tour of leveling up on consumer health service and patient portal experiences. We've got some great things to show you today and just take you through a quick agenda here in the short time that we have. So what we're going to look at is an overview for providers and patient portal services and where LucidWorks Fusion meets those needs, elevates the experience, talk a little bit about the benefits of personalization for patient needs when we look at an authenticated realm behind a patient portal as well, and as a consumer experience, and then demonstrate some conversation around search and strategies that providers are looking for today. So look forward to moving forward with that, and we'll go to the next slide. So just a couple of setup thoughts here, right? Providers have been trying really since the dawn of coming through the consumer age of portals, trying to help them navigate the digital journey. And they're using a lot of different types of technologies. So search is just one of those technologies. There's the CMS platform itself, the framework around it, how they access the digital front door. And then from that, really authentication into the personalization and things that we can see and experience on the web today, of course, and with our mobile phones. But there's a lot of technologies involved across the framework of what they're trying to deliver. So it is a complex technical stack usually in that regard, and search is one part of that journey. From the roles themselves, right? The consumer spectrum, we're all pretty much consumers of healthcare in one way or another. On the outer ring of that is how you're experiencing a health system. If you've never touched that health system before, you're out there just searching their site or searching on the mobile phone. If you're already a patient through potentially some means of a clinical exercise, maybe it's getting a vaccination. Let's talk about, like, say, CVS. Well, you're a customer at that point. Are you really a patient with a deep encounter experience? Probably not. So the next piece of it would be, that encounter itself, and what you need from the system in more complex encounters would be the next piece of it. And then as a payer to that system, or your insurance being a part of that, that last piece of it, and the most maybe even complex, is navigating that payer system within being a patient, or if you're in a family with a child, being a pediatric member, to having a hierarchy. So somebody's paying the bill for you in your family. So there's a lot of concentric circles of intricacy when you go through an experience with a provider. And we'll kind of talk through a little bit of that too in some of these examples. From an outcome standpoint, what we're all trying to target here is from a provider standpoint, is customer satisfaction and the patient experience. They're trying to maximize a greater in-network utilization of their resources, their hospital, their system, their provider staff and clinicians. They want to enable self-service like we're doing with the web every day today, with other types of encounters in retail and consumer experiences, and increase loyalty, right? So we always talk about how the stickiness is of the nature and the referral in-network can be for a provider. And then larger trends in automation and bringing conversational business applications, for example, and data to the front of that experience is really what we're targeting as well. So I'm gonna turn it over to Sean, and he's going to walk through some of the experiences, and we'll take up some questions from there.
All right. Great. Thank you, Stephen. Welcome, everybody. Thank you for joining. First demonstration that we'll do is from Children's Health. They're a health system, a pediatric health system out of Dallas, Texas. And we're going to take the scenario where I'm a parent, just found out that my child has a heart murmur, and surgery is in the future for my child. So I'm trying to learn more about the condition. I'm trying to understand which doctors at the hospital can provide that type of care for a heart murmur for my child, as well as a surgeon that could perform the procedures that we have planned in the future. So right away, I can come into the search bar. If I start to type heart murmur, you'll see that we've got some dynamic type ahead suggestions that pop up. So right away, I see the keyword heart murmur is an option. I'm also starting to see some doctors immediately that might be able to help treat my child, different services that the organization provides, different programs, et cetera. I'm just going to go ahead and click heart murmur, plug the keyword in, and that should take me to the main search results page. At Children's Health, we break up the page into kind of a card style experience. It's a familiar layout for pages and content. As you can see, we break that up across facets and filters across the top, and then we also organize and categorize the content below in the same fashion. So if I want to see all of the conditions, for example, I get a new filtered list of just conditions. I can take a look at providers as well, or even locations that treat the condition. As a parent, I want to know more about a heart murmur, so I'm going to go back to the conditions filter, and I'm just going to go ahead and click on pediatric heart murmur. The great thing about LucidWorks is its integration capabilities with content management systems. So content authors at Children's Health, they can quickly deploy new pages using dynamic search components on the page to build out the content instead of typing into individual content authoring forms in a traditional, like you would see in a traditional content management system. So immediately on the right-hand side, LucidWorks Search is looking at all the locations to identify places that will treat the heart murmur based on tags on the page. We've also got some related departments that are helpful and related content. Again, all three of these components on the right-hand side are checking page tags and then ultimately doing a search against the index and bringing back those items. As we scroll down the page, we've got some traditional content management system content that the content authors fill out, but we're also doing more with frequently asked questions, additional resources, and most importantly, providers that can treat my child's condition. And as you can see, we've got a long list. This is, again, a search component that's reaching out to our provider database. And like I mentioned, I'm looking for a surgeon, and with the top score within the search index is Dr. Robert. As I click through to that, again, some basic, some general CMS content. I can request appointment. If I'm another physician, I can refer a patient to this particular provider. And then at the bottom, you'll notice, again, some more integrated search components that are reaching out to our conditions index, our treatments, departments, and programs, and pulling this data back so that content authors don't have to manage this. The next site we'd like to show you is Memorial Hermann. They're a large healthcare system here in Texas, and they've taken a different approach to type ahead search suggestions and implemented some really cool filters and facets for finding different providers, conditions, and treatments in their site search. So similar scenario, I'll search for cardiology. And immediately you can see that I'm getting a set of specialties, conditions, treatments, a new layout, kind of a completely different UX on the type ahead suggestions. Instead of just plain text, we're also bringing back, item counts for that. But if I go ahead and finish my search out, I'll go ahead and click on view all results so you guys can see what that looks like. Again, a similar layout to the type of search suggestions. You're getting doctors and locations with images, graphics, and again, just kind of a subset. And then you can drill into those areas that make more sense. So if you're looking for a specific, like a heart murmur condition or something like that, you can drill down and continue to search. Next, I'd like to take you into doctors. So we'll jump in and view all the doctor results. You can see that I've got 331 right now for the search term cardiology. I'll just let you see what some of the filters and facets are that they've implemented for provider search. So right away, you notice that I've given them permission to use my location. So that's going to help me filter and find physicians that practice close to my area. Again, I've got 331 results, and we give users a different way to view the page layout. So on mobile and iPad devices, this might be helpful. The first thing I'm going to do is probably change and select my insurance to make sure that a provider that I do see or does come back in the search results at least takes my insurance plan. So we do that, and that filters that down a few results. It's good to see that my plan is widely available across the organization. But I'm also, like I mentioned, I'm kind of an antsy parent. I'm wanting to get things scheduled right away. You can see that I have the ability to show only providers with online scheduling. So this immediately narrows down my results to 20 results, and they all have the ability to schedule online. I'm also really interested in being seen in the next 7 days. So I can select that as a filter. And it's actually taking a look at the physician's schedule to see if they have anything new coming up in the near future. I'll be a new patient as well, so probably ought to select that as well. Accepting new patients, and again, it filters it again to 7 results. Here we are on the provider's full profile page. Again, this is a dynamically built page using LucidWorks query pipelines. The doctor's full profile is presented, his image on file. We're providing locations out of our locations index, not only his primary location where he sees patients, but some backup locations. And then all of the other metadata that would generally be found in a provider database, like languages spoken, education, and specialties. Finally, just to kind of show that we're also searching other data sources, such as their scheduling system. I mentioned in my facets and filters up front that I wanted to see a doctor that accepts new patients, as well as has something available in the next 7 days. And so you can see we can schedule appointments right here in line with the provider's profile. Has the patient been seen? No, he's not, but it still lets me continue because it remembers my preferences. And then ultimately does find me an appointment here within the next 7 days that I can begin scheduling. And then we're just linking out. That takes you to the scheduling system for this particular location and physician. And the scheduling system takes over from there.